Check and verify the doctor's order in the client chart. Assess also the client's ability, comfort, muscle strength, paralysis, and instruction following ability. Next, perform hand washing or hand hygiene. After that, gather the materials needed for this procedure. In this procedure, we'll be needing wheelchair and a transfer belt. Next, confirm client identity and explain the procedure.
Good morning, sir. My name is Crystal Robles, your student nurse for today. I'll be your nurse from 7 a.m. to 7 p.m. So may I know po your name and your birth? Age po.
20.
Birth. Okay, to check with that, may I see your identification? Okay. So for today, sir, I'll be transferring you from bed to wheelchair. For your, we'll be transferring you to the radiology department for your X-ray. Is that okay with you, sir?
Adjust and lower the bed to the lowest position. Raise the head of the bed, but here in our situation, we will just assist our client to sit down. After that, place one arm under the client's leg and one arm behind the client's back. Then slowly pivot the client so that the client's legs are dangling over the edge of the bed. Then ask the client to dangle for 2 to 5 minutes.
Sir, I'll be asking you to double your feet.
Next, bring the wheelchair close to the side of the bed and place it at a 45-degree angle. Then lock wheelchair brakes and elevate the foot pedals. After that, put the transfer belt. The transfer belt should be grasped at each side to provide movement. Lifter's knee should be well flexed. Then rock the client's body up to standing position on the count of 3. Lifter and client pivot turn so lifter is facing the chair and client's back facing towards the chair. Then instruct the client to use their arm to rest on the chair. After that, ensure proper sitting alignment. Support the weak side with a pillow if needed. Next, fasten the safety belt, position feet on foot pedals, and release brakes if moving.
So good day, everyone. Today we'll be assisting our patient. We will transfer him from the bed to the stretcher. But before we start the procedure, since we don't have the actual stretcher, we improvise a stretcher here, and we also don't have the lifter board, so we'll be using a blanket serves as our lifter board. So we'll be greeting and identifying our patient. So good morning, sir. My name is Crystal Robles. I am your student nurse for today from 7 a.m. to 7 p.m. So for today, sir, may I know for your name, age, and birth first?
My name is Rafael Tito.
Check with that, may I see your identification. So for today's procedure, sir, we'll be transferring you from your bed to the stretcher, and that requires us lifting you and touching you and asking you to do some movement. Is that okay with you? Before we start, we'll be uh, raising the bed and checking the bed for the lock. After checking and lifting and locking the patient's bed, I'll be needing or will be needing 3 assistants or 3 nurses for the transferring of the patient from bed to the stretcher. Next, we will be placing our lifter board or our blanket under the patient's bed. Sir, asking you to turn over to your right. Count of three. Count of three. 1, 2, 3. On the count of three, I'll be asking you to turn over towards me. Okay? And 1, 2, 3.
Next, call for another healthcare team to assist with you in transferring the client from the bed to the stretcher. Then move the stretcher near to the bed. The first lifter should lift and support the client's head. The second lifter should lift and support the client's lumbar or waist. The third lifter should lift and support the client's leg. Instruct the client to cross their arms over their chest. On the count of 3, lift the client and transfer them to the stretcher and provide pillow under the client's head for comfort. Next, ask the client if they are comfortable.
Are you in a comfortable position, sir? Okay, good.
Before positioning the patient, ensure that the bed is firm, clean, and dry. Next, prepare the materials needed such as pillows.
Hi, sir. Asimo. I'm gonna be assisting you in a prone position. Is that okay with you, sir?
Place a pillow under the client's lumbar or abdomen area and ask them to turn over onto the pillow. Place a pillow under the client's head and legs.
Sir, I'll be assisting you in a supine position. Is that okay with you, sir?
Assist your patient to lie down. Place a pillow under the client's head, lower back, and legs. Also, place a pillow under the client's arm to provide comfort.
Sir, I'll be assisting you to in the fowler's position. Is that okay with you, sir?
Next, assist your client to sit down and support the client's back with your arms. Then place all the pillows at the client's back to support them in a fowler's position. Don't forget to ask the client if they are comfortable.
Are you comfortable with your position now, sir?
Yes. Good day, sir. I am Alison Day. I am your nurse, student nurse for today. I will assist you to Sims position. May I know your name, sir?
John Lee Tassi.
Your age, sir.
Thank you.
Ask or help the client to lie on their left side with their lower arm behind their back. Next, place a pillow under the flexed upper arm for support. Also, place a pillow under the upper leg that is acutely flexed. Ask the client if they are comfortable.
Are you comfortable with your position, sir?
Yes.
Good day, sir. I am Alison Day. I am your nurse, student nurse for today. I will assist you to lateral position, sir. May I know your name and age, sir?
John Lee Tassi. 20 years old.
Can I take your
Ask or help the client to lie on their side with the top leg in front of the bottom leg and the hip and knee flexed. Place a pillow between the client's top leg and bottom leg for comfort and support, and then place a pillow under the client's arm to maintain a comfortable position.